topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Dallas-Fort Worth. Welcome to another Ask the Expert show, where we bring you the finest experts in the field of legal, health, financial, and home improvement. I'm your host, Steve-O. We're with you every Wednesday at 4 o'clock to about 4:50. And it was really strange today. I was thinking about my doctor, and I was thinking about so many people are moving to the Dallas-Fort Worth area. And when you do that, you do not have a doctor. And I was thinking about, gosh, how do you find a doctor that is so good that you're going to just get along with great and you're going to trust? And I was thinking about our expert who's coming on now, Dr. Gamboa. Good afternoon, Dr. Gamboa.
Hey, Steve. How are you? Thank you so much for having me.
I got to tell you, I am so jealous of anybody who lives in the Dallas-Fort Worth area, has the opportunity to have you as their family physician. I went to your website today. We've been doing this for 2 years together. I went to your website today, and I was reading, and I did not know, even though it's part-time, I didn't know you teach.
Yes, Steve. Thank you. I only do it once a month, and it's like half a day, but I still supervise the residents at UT Southwestern, and it's pretty interesting. It's a different thing, it keeps me on my toes. I have to be reading stuff because then they ask you questions. So it's very interesting. It's pretty nice.
You kind of feel like you're giving back?
Yes, and also, whenever I started, after graduating from Texas Tech, I liked so much, and I got along very good with the faculty and everyone in the clinic and the program, that they invited me to be a full-time faculty. So I became a full-time associate professor at Texas Tech, and I stayed there for probably 3 more years after graduation. And then that's whenever I decided to move to the Metroplex area. But it was a lot of fun.
Well, we're getting so many letters about your show. Tell people about your practice.
Sure. Thank you, Steve. Yes. As you said, I'm a typical family medicine doctor, that will take care of your acute, chronic problems, diabetes, hypertension, and everything. And then I also do weight loss. And then hormone replacement and hormone optimization, because everything goes together. And now I'm adding a little bit more of cosmetic things for whenever you lose the weight. Then we can do toning of your muscles or areas that you didn't lose that much weight. Then we help you with that. We have the Evolvex. And then also I have for the skin rejuvenation and tightening of the collagen, I have a Morpheus and then also Lutronic lasers.
Well, I made a list that I got from your website that I'm going to go down. And these are areas that you service. But I have a question I could not wait to ask you.
Tell me.
I'm on Ozempic.
Yes.
And Dr. Gamboa, I don't want this to be a commercial for them. Oh my God, does it work? I mean, I've lost about 30 pounds. I've been on it for about 4 or 5 months.
Mm-hmm.
I guess what my question is before these skinny injections came out, you had a lot of different ways to get people to lose weight. I got to tell you, these skinny injections are an easy way to lose weight and more than likely are going to work. Does that eliminate maybe things that you did in the past and say, I'm just going to put you on a skinny injection and you're going to lose weight?
No, Steve, like, and thank you for bringing this up because I know, like, it feels like really helpful and everything, but like, at the same time, if you don't change your habits, if we don't take care of the root of the problem, this is only like a little band-aid. So we definitely need to work together to change your habits because you cannot be injecting Ozempic and still drinking soda, eating your pizza
Yeah.
the same way you did. So we have to do some kind of like lifestyle modifications to help the medication too. And with this, like we can reverse diabetes and we can do a lot of things. I have many patients that they stop using the insulin whenever we switch them to this. So many things. And to answer to your question, if I only do this more than anything, it's a combination of things because again, we have to continue helping your metabolic rate. We have to still like optimize your hormones. We still have to optimize your thyroid. You still have to consume enough protein, even more so than regular whenever you're not using the injections because yes, any weight loss is going to make you lose muscle mass and fatty tissue. But with these medications that they tend to make you lose weight faster, we are seeing that people are losing muscle mass faster too.
Oh,
To make sure, like, and then for you also, make sure that you increase your intake of protein. We have to do a little bit more protein than usual. And you have to do some resistant exercises to help your muscle mass and build your muscle so you don't lose as much. But it's a combination of medications. I still give the medications. I still combine it with the injections. And of course, the pillars are healthy lifestyle and changing your habits because if we don't do that, nothing is going to work. Even if you had like a bariatric surgery, if you don't change your habits, you're going to
oh
regain your
yeah.
weight a couple of years later.
Where is, I've seen these commercials. God, there's a lot of commercials now about this injection,
Oh,
but
yes.
um, I was told to take it in your stomach, but on TV they show it giving it in your leg. Which
Yes.
is the best way?
Well, honestly, it depends on the patients. So there are patients that they prefer using both hands and they use it around the umbilical area, like the insulin, the same areas. Or if you want to do your two hands on your leg, you can do it your leg, or if you want to do it on your arm. But it depends on the patient. Some patients prefer on the leg, some patients prefer on the abdomen. So it depends.
So are you saying it doesn't
It
matter?
doesn't matter. It's not going to work better if you put it on the arm. It's always we recommend the patients to rotate the areas because we don't want one area just to get a little bit more scar tissue and then not absorbing well. So you have to definitely rotate different areas and not to do it in the same area all the time.
Um, we had right before the show, they saw it on Facebook. They wanted to know what your hours are and what days you're open and closed on.
So I open Monday through Thursday from 8:30 to 5:30. On Fridays and some Saturdays, like 2 Saturdays a month, I open the office from 9 to 1.
So you are open on some Saturdays.
Yes, I used to open almost every Saturday a month, but that gets tiring, Steve. And now I am only 2 Saturdays a month.
And, I want people to realize you're an MD, which is important. Um, do you admit patients to the hospital? And they want to know, if so, which ones?
Unfortunately, like the type of like practice that nowadays we all have, it's not like the olden days that yes, I can admit to the hospital, I can go around on you and then come back to my practice. That is more complicated nowadays. So nowadays there are teams of hospitalists. So let's say you still have to have your privileges to go into a hospital. So I have admitting privileges at UT Southwestern and Parkland because I work with them. I only have some privileges with Baylor, that is mostly the community a physician that I am, but we don't admit to them. We just send them to the ER, and the hospitalist team takes care of the patient. And then whenever they discharge the patient, then you go ahead and follow up with them.
Oh my God, it's so different now.
Yes.
Wow.
Yes. I know. Before it was like admitted. Yes, you call the ER or you call in the orders, admission, and then like you can go and round the patient. And that's that's the old-fashioned, olden ways that we used to do it. But now it's like we don't really do it that way anymore. Probably some specialists, they probably do. The cardiologists still have to go to rounding the patients. The people that they do the surgery still have to rounding their patients. But we don't really, family physicians, we don't really have to do that. They have hospitalist teams. Every hospital has that now.
Okay. So I'm going to go over some of the areas that you service, and you tell me, like the first is acute diseases that you treat. Tell me about that.
Sure, like this means like any urinary infection, any sore throat, anything that happened acutely, like meaning like or you have like a back pain or sciatica or anything that
Uh,
happened like that, then I can help you with that. And there's acute. So whenever you call our office, you're like, hey, I'm sick, and then we can try to find you a little spot, or like I give recommendations until I can see you. But if you have something like a possibility of broken foot, I rather you go to a urgent care that has ortho capability. So you already have your X-ray ready then and there, and then they
right.
help you because I will have to send you there. So it's more time. We waste time on that. So it's easier to just go one place, have the X-rays done it, and that's it. And depending on what kind of suturing, I can do some suturing. But if it is more like a deep or complicated, or I think that a tendon may be compromised, then definitely you need to go to the ER and things like that. I mean, it's not like an urgent care, my clinic, and but at least if something needs to be done, then we can help the patients.
Boy, this is a great question. We just got a text. Love your show. I never miss one.
Thank
Um,
you.
how do you keep from getting sick when you're around sick patients all day long?
That's a good question. Honestly, I just like take my vitamins. I do my probiotics, and then also my vitamin D, my zinc, and that's what I do. Because also like I guess like being around a lot of sick people, you also build antibodies, and you're more likely not to get sick. It's like whenever you take your kid for the first time to daycare or to school, they get sick all the time. But once they are already like used to like build antibodies to all these little germs, viruses, then they're less likely to have, or like they're not as frequently sick as they used to. So that's what happens. But honestly, all the probiotics, that makes a huge role. Like I was recently on a conference with weight loss and integrative medicine, which was awesome. And this one tells us about all the prevention that we have to do, like the probiotics that we have to do to take, and then also to prevent leaky guts, to prevent all these toxins to get directly to our bloodstream. So it's super important to take probiotics on a regular basis. Try to avoid eating a lot of processed foods that are going to distort that lining of your stomach. And it's so important to have a really good ecosystem and microbiome.
So, do you think your immune system is a lot higher than most people?
I think it's a little better, yeah. Like because like sometimes my kids also get sick, and I may get a little sore throat, but I don't get the fever or anything. So that means that yes, I'm already like building some antibodies. But that's usually what happens. And don't get me wrong, I get sick too. Like last year I got like strep throat, and it was really bad. But at least it's not very frequent. But you know, still.
Yeah, you got to take a Z pack for that. I'm kidding. So you do weight loss. That's a big part of your practice.
Yes, yes, I love this because I can see how like the patients get like so happy whenever they lose their weight. They can see the results. They're not frustrated anymore. There's not like I guess they can find in me someone that is not telling them, oh, only eat better and do exercise and I'll see you later. So I can understand and I see where the problem is coming, because many doctors for the longest, that's what they were saying. Oh, you're eating too much and you're not exercising. So do that and then you're going to lose weight. But they didn't understand that all this metabolic problem, the hormones, and so many factors. If your cortisol levels are high, the stress level causes the cortisol. So it's a vicious circle. So if we can go ahead and do some supplements to help you with that, if we can do some like breathing exercises to decrease that anxiety, the stress, so many things can get better.
You know, what I am so upset about is that when you're overweight, it causes so many problems, health issues to your body. In my case, it was kidneys,
Yeah.
sleep apnea,
Mhm.
and I don't understand why insurance companies do not help supplement this when it's going to save them so much money in the long run.
Exactly. And that's what they don't understand. I mean, they only see you as like short term, because in their minds, it's like you're going to switch employers, you're going to switch insurance companies. So they don't really care much about you in the long run. Like, yes, that's the common sense and what we are all advocating for. Hey, let's prevent this from becoming diabetes. Let's prevent this from like becoming or having a sleep apnea. Let's prevent this from a heart attack or stroke occur. But unfortunately, they don't see it that way. They just see, and unfortunately, I don't want to be political or get political here, but I think I heard Senator Bernie Sanders saying that the weight loss medications will bankrupt America. And unfortunately, that's not going to bankrupt America. The one that is going to bankrupt America is
Wow.
all these chronic diseases that are haunting us, the diabetes, like the obstructive sleep apnea, the heart attacks, the strokes, so all that, the dementia, everything that goes along with the obesity. But unfortunately, because they only see it in the short term and oh my gosh, these are so expensive. I agree, they have to go down in the price so that everyone can get access to it and so everyone can get coverage. But we cannot just say, oh, this is too expensive. No, we have to prevent this. We have to help the patients to decrease the obesity, to lose weight, so then they're going to get better. So that's what they don't see it.
There's so many things health wise. I know that I didn't go to the doctor a lot. A lot of men are like that. That they don't think they need to see a doctor.
Right.
But I didn't know my blood pressure was high. I didn't feel any different. But the longer my blood pressure was high and I wasn't treating it, it damaged my kidneys.
And then your
So,
heart.
and
Yes.
then your heart. And it just, I know people want to look good cosmetic wise, but I got to tell you that uh, being overweight causes your body so many problems, serious problems.
Yes, this is no more like, as you said, cosmetic thing. This is not because like skin is the new norm. No, like we have to make sure to understand that the fatty tissue causes inflammation, metabolic inflammation. And in this conference that I was, they were calling it like a new term, metaflammation, because it's a metabolic inflammation. And this is what's causing all these problems, increasing the risk for heart attacks, for strokes, increasing the risk for like even dementia, because they're seeing that a lot of these endotoxins are crossing the brain barrier, and then they are causing all these problems. Then also they see the increased risk for cancers whenever you have obesity. So we definitely have to help our patients lose the weight.
We just got another text in. This is from Plano. They want to know, are these meds that are advertised on TV that help your memory, do they really work?
Which are they talking about supplements that they advertise for memory?
Yes, I
Probably.
think so.
So like, the only problem I have with supplements is that you have to get it from a very respectful place, and because what happens is that unfortunately the supplements, they don't have a lot of overseeing of any kind of like what do you call it, like the FDA, for example. They don't
Yes.
check that, so that's why you have to always look for some places that they sell supplements that are reputable, and they have like this third party random like audits that they are going to make sure that pill number 100 is going to have the same ingredients like pill number
Oh,
one.
that's right.
So you have to do that. And also in reference to like which are the supplements that they help the most. So like honestly, like the ones that they help you the most are omega-3/6, that are the building blocks, and also they decrease like inflammation. Then you're going to need vitamin B12 because like that also helps with your central nervous system. Then you're going to need vitamin D as well. So all of these little things that unfortunately nowadays are vegetables and our fruits or our grains, they don't give us anymore, like less and less, they're not having a lot of nutrients, and we have to supplement this. That's why we also have to make sure that, again, we go back to good probiotics, gut supplements, but like magnesium. There's so many people on proton pump inhibitors like the esomeprazole, omeprazole, all these acid reducers. They are blocking all this absorption of the magnesium, and we need all that, like not only for our muscles, but also to decrease the insulin resistance, to help with many things. It helps calm down. So many things that they can help us.
I'm going to make this our final question. This show always goes by so fast. This is a great question. Do masks really help from getting these diseases?
Yes, they do, because if they don't prevent from the bacteria and all this, so what is the purpose of all the surgeons using a mask whenever they have to do a
That's
surgery, right? They do work, like probably like in the era of the COVID, unfortunately, it was so politicized, it was so many like confusion. We didn't really know a lot. We were learning as we went, so like probably
Yes.
now we're not going to recommend the fabric knit masks, because we know that that's not going to cover you and that's not going to do. But if you use the surgical grade masks, for sure they're going to help us with more than anything. They're going to protect the other patient, like from like getting, if you sneeze, like you're going to sneeze like within your mask, and it's not going to like spread anything. So more than anything, they help prevent spreading the thing more than you getting something. But that's what we want, to make sure that we don't spread it.
Dr. Gamboa, I love doing this show. I always learn something from you. Dr. Gamboa is with us the last Wednesday of the month. She'll be back again with us next month. I apologize all the people who texted questions in. Just join us again next time. Dr. Gamboa, give everybody your phone number and your website.
Sure, like Steve. And I was going to tell you that you can like save those questions for next time, so we can like keep answering them. My phone number is 469-947-6020. And the website is www.elitecare-clinic.com.
And I know her voice sounds too sweet to be a doctor, but she is. And Dr. Gamboa, thank you so much. We'll see you next month.
You too. Take care.
Harold,
Protein and probiotics.
Okay.
Alrighty. Bye-bye.
That's Dr. Gamboa. She's an unbelievable doctor. Anyway, that's it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.